You're watching the Wellness Hour, news that makes you healthier. I'm Randy Alvarez. Today's topic, replacing missing teeth with dental implants. According to my first guest, he says no one should be wearing a loose-fitting denture. We're talking about Wichita's periodontist, Dr. Marq Sams. Dr. Sams, welcome to the program.
Thank you very much.
Now, I know you brought photos, so we'll get to as many of those as possible. But for people that don't know your practice, you have a large practice, who's the typical dental implant patient?
Well, we don't have a typical patient. Basically, you have two categories. You have the patient that's been fighting bleeding, swelling, teeth breaking off.
Okay.
And then you have the other category where you have patients that hasn't been to the dentist.
Okay.
Don't want to go to the dentist. And those are typically denture wearers. They're done with it. They got their denture and they don't want to see a dentist again, which they don't know
How good it could be.
How good it could be.
And you say that the denture wearers are people you could actually help the most because they're the ones that can't chew the most.
Correct. And they've adjusted to it. Over time, they've gotten used to eating soft foods and things like that. Bananas and oatmeal and
Just soft foods.
Right. Non-satisfying foods like steak and apples and stuff with crunch to it that you have to have substance. You lose so much bite force from wearing a denture, and they don't even know. They don't know what they don't know.
Okay. Now we should mention, as a periodontist, dentists from all over, I guess, Wichita, all over Kansas, they send you patients when they have the bleeding gums, the bad breath, the loose teeth, when they're in bad shape, right? You're in trouble when you go to the periodontist.
Correct. You don't want to see me unless you have to type deal. And like I said, my typical patients are those patients that are sometimes at a point that we can't even do anything except for remove their teeth.
And give them new teeth.
And give them new teeth, correct.
So in Kansas or in Wichita, are there a lot of people, back to the denture wearers, that are wearing dentures?
It's hundreds of thousands of people that are wearing dentures. It's 3.6 million people in Kansas, and 500,000 have dentures.
Is that right? So it's a big problem. Well, if implants are so good, right, then why aren't they all coming in to do this?
Well, the number one reason why a denture wearer wouldn't go to a dentist, they don't need to go to the dentist. They don't feel like it anyway.
All right. That's fair. So they just don't know their options.
Correct. Correct. They don't know their options. They don't know that they could get dental implants to help stabilize their teeth and function better. They feel okay. They're afraid. They're afraid of the expense. They're afraid of the pain. So you have those patients that have been to the dentist for multiple years. They're, like I said, fighting. They had root canals, cavities, crowns, deep cleanings, all that stuff. And why would they want to go to the dentist? They associate that with pain and money.
So these denture wearers, and is this true? You can literally walk in on the day of the actual procedure, walk in with no teeth, walk out with teeth that actually don't even come out. Is that right?
That's correct. That's correct. The patient comes in that day, have the surgery. Of course, this is after the consult and all that.
Yeah.
But the patient comes in for the surgery. A couple hours, they're walking out without teeth or with teeth, and they're functioning.
Is this the happiest group of patients of all dentistry? Like the people that had no teeth and now they get teeth?
Well, I would say the happiest are the ones that come in with teeth that are compromised. They have the bleeding, the pain, the swelling, because that's all gone that day.
So literally you could do a full mouth of extractions, give them a brand new set of teeth, and they could walk out with that.
Correct.
Is that right?
Correct.
Is that an exaggeration?
That's no exaggeration. It's an amazing type of treatment for patients, the confidence builder. I can't even explain it. For the patient, it's amazing type procedure, and that's why it's been so successful, and that's why it's taken off.
How old can you be to get dental implants? Somebody in their 70s or 80s. Too old?
No way. That's basically a typical patient for our practice.
Is that right?
Yes. 60, 80 is typical. We've done it on 90-year-olds.
Why would a 90-year-old want to do this?
Well, why would anybody want teeth? Why would people have teeth in general? They want to be able to eat.
Okay.
And basically the trend after that, what I've noticed is that they get function, but then they start taking
What do you mean function?
They're able to chew better. They're able to eat their food. I had a lady that had implants or was looking at implants. She was 86 years old. And she basically told me, she asked me, am I too old to get implants?
Yeah.
I paused. She took over, and she was like, no, the only thing you need in life is to breathe and eat.
Okay.
Done deal. I mean, that's the simplest you could put it.
So in your 80s, I mean, they're not more likely to fall out?
The implants?
Yeah.
No, it's no problem.
So it doesn't matter how
with
old
that.
you are?
No. Like, we've done implants on a 98-year-old. I mean, they're still in there.
98-year-old.
Yes.
And then they could eat and chew whatever they want?
Yes.
Really?
It's the best thing since sliced bread.
Is that right? Now, you brought some photos. What are we looking at? Give us some examples.
This patient is dear to my heart. I just love the guy. He's out in the public. He speaks a lot. He was in my practice for several years before we had to make a decision. Basically, he had periodontal disease. He does excellent oral hygiene. A lot of people think, they're losing their teeth because they don't take care of them. He was taking care of them, but the teeth were getting looser, and basically we had to make a decision. Were we going to do patchwork and try to fix this area and fix that area and try to make stuff match, or were we going to take out his teeth and give him new teeth? And that's what we decided to do. The options were dentures, and for this guy, no way.
He didn't want a denture.
He definitely didn't want a denture. Like I said, he's in the public. You can't talk with a denture. I mean, you can't eat or function with a denture appropriately. For this guy, no way that was going to be sufficient for him. So we brought him in that day, IV sedation, took out the teeth, gave him new teeth. He wakes up, he's a happy man. So when he wakes up out of sedation, his wife comes in, and she's like blown away. It's amazing. And she's like, oh man, it looks like when you're, 20 years younger. And he felt the same way looking in the mirror. It was a special moment. These patients go years without smiling, 15, 20 years, maybe even longer.
Really?
And after compliment and confidence builds, you can see their smile gets bigger and bigger as that happens. So yes, he comes in now, and you can see his full smile.
Is that right? Now, you say it's life-changing, like for these people. And even you're surprised sometimes at what a big deal this is for them. Elaborate.
Well, I mean, a lot of people come in, like for example, him. He came in, or he was already in the practice, and he was like, I can't eat, and my teeth are loose. You get those teeth in there, and yeah, function's still important, but the aesthetics part, as far as appearance, it like takes over. I mean, their whole energy about themselves, stuff that they didn't even think about, comes out. As far as kissing their spouse or smiling or eating in front of friends, they didn't realize they were not doing those things. It's amazing thing to see somebody come in afterwards after a procedure like that, because they dress different, they have another ear about themselves, they're positioning or holding themselves different. It's just, like I said, it's an amazing thing to see that I can't describe it.
When you say things like it changes both of your lives, what does that mean?
Well, obviously, his life is, or their lives are going to be changed, because, I mean, they're able to do things they were not ever able to do or felt confident enough to do. Go out for job interviews and smile in front of their family and friends and eat. I mean, how can that not be life-changing?
That's true, yeah.
For me, I mean, the gratitude to be a part of something that's special like that, I mean, you can't be
Because you said you love it. We're in the green room. You said, I love this.
I do love
You really
this.
do.
It's amazing. It's the best procedure that I do. I mean, it's the enjoyment to get out of someone instantly like that in a day. That's life-changing for both of us.
Get new teeth. Now, you're a specialist. Does it cost more to go to a specialist to get this done?
No way it costs more to go to a specialist. Basically, I look at it as a way to get it done right the first time.
Okay.
I'm the gum specialist, or periodontist, or whatever you would like to call it. So who is the one that's going to determine whether those teeth are going to be saved first or not?
Okay, it's fair.
So if someone comes in and lose teeth, can we save them? Or do they go somewhere else and they're like, oh, we got to take them out when they could have saved those teeth? We're the ones that it's the end result that says, hey, these teeth need to be taken out. Let's do this, this, and this. We've had the training for it to do the implants, and we have the training to save teeth. So we should be the first option.
Now, you use lasers, too. I mean,
Correct.
You're saving teeth because it's a bacterial infection, Is that right?
It's a bacterial infection.
You kill this infection with a laser.
Right.
Is that right?
That's one of those things that we've implemented for a while now to save teeth. It's a bacterial infection that causes teeth to be lost. It eats away the bone, and you have loose teeth, swollen gums, and pain, discomfort. And that's the one way that we are able to do that. So we go back to who's the person to determine that? I can save your teeth. Right, exactly. I can save your teeth, but I also know when enough is enough. So you're not wasting your time and money.
Okay.
Or you're not even putting in a denture also. And not
so
giving
no more
options.
dentures. Do you think this is the future of dentistry? Maybe it'll take 100 years, but dentures as we know them today that are just kind of resting on the gums or floating on the gums will be gone?
Yes. Implants will be the standard of care one day. I can't tell you when, but that's the only thing. I mean, you can't function with the denture appropriately.
I know a couple of denture wearers.
Yes.
They never complain. Are you saying there's no such thing as a happy denture wearer?
Like I said before, they don't know what they don't know. They don't know they're not functioning well. They've changed their diet so much.
Okay.
And now they're eating.
So they don't know what they're missing.
Right, exactly. Exactly. They don't know what they're not. They don't know that they're guarding or tightening their muscles to keep their denture in, or trying to eat soft foods, or avoiding events because of the denture might fall out. I mean, yeah, they're fine. It doesn't hurt them, but they don't have confidence in themselves, and they don't realize they don't have the confidence because they're so used to wearing a denture. I mean, well, back to your statement about denture wearers, they're happy and they don't complain. They do complain. They're not going to complain to you.
Okay, that's a good point.
But when they come in and we give them teeth that they don't have to take in and out, those patients are the happiest patients because they don't have to constantly think about, oh, my teeth, I got to clean them, I got to get them relined, I have to go back to the dentist, they're loose, they sore, et cetera, et cetera. They're their teeth. And now they don't have to think about, they treat them like their teeth they used to have. And now they don't have to be concerned about going to the bathroom to hide it and things like that. I had this one guy that came in and he was suffering from wearing a denture. He didn't say too much, but you could tell that I could tell that he was dejected from his body posture or how he was holding himself. But after he got his teeth, that's when a lot of times you hear the story. Oh man, I couldn't eat, or man, I'm so glad I got these teeth now. I could go out in public. I don't have to be embarrassed. They're not falling out. And that's the best story that I could get is when I know that I've changed somebody's life that much, that stories that they were embarrassed to tell or not tell people, now they're telling everybody. I'm gonna give you this little case right here.
Okay.
This lady came to me, and it's actually a common story that I hear from a female perspective, is that they've been taking care of their kids and now it's their turn.
Okay.
This lady had severe periodontal disease. I mean, she had the bleeding gums, the typical swollen pain, discomfort, and she was looking for a solution. And we had it. Their solution was to get rid of those teeth because it was too far gone at this point.
So she would have had to have a denture in most places.
Which is unacceptable because...
In your office.
Oh, for sure. It should be in any office.
Okay.
I mean, she's way too young. I mean...
To be wearing a denture.
To wear a denture, for sure. She would lose teeth, she would have to get the repairs and all this, spending all this money on adhesives and all this other stuff. Hands down, the dental implants was the better solution for her for multiple reasons. Confidence, the ability to chew.
Was she ashamed of her smile?
Oh, yeah. I mean...
They tell you that?
Yeah, they'll tell you, and you'll see it. People cover up their mouth.
Even in front of the dentist, they cover their mouth?
In front of... I tell a good joke.
Yeah.
They cover their mouth up. I mean, it's... I don't think a lot of times they're aware of it, but they do it all the time.
So what did you do for her?
Well, basically, we brought her in and we removed her teeth and gave her a new smile. She woke up from the sedation and she was ecstatic, to say the least. She was very impressed about how things looked.
Let's take a look.
More than function.
Wow.
That's a very, very good picture. As you can see, she's like I don't know, 20 years younger on that picture.
She looks better. She looks better.
Oh
a
my
lot
gosh,
better.
it's amazing. She's a beautiful lady in general, but you can tell she's lighting up. I have another picture I would like for you to look at because I think that kind of shows the true fullness of her smile. I mean, you can't even tell that's not her natural teeth. I mean, that looks as natural as you could possibly get it.
Yeah, they look good. They look good.
And now you can see the full complement of teeth. It takes time for these people to get used to their teeth. They've been hiding it for so long, and now it takes time. It takes those compliments that they get from other people to know they can really open up their smile and really smile.
Is this one of those things that when it's all done, they go, I should have done this years ago?
Oh, yes. I got a great story about that. This is an 86-year-old lady, one of my favorite patients. She's so awesome. She came in. She couldn't eat. She's actually going to the doctor. She was on like 9 medications. Going to the doctor, she had lost 20, 30 pounds, and the lady was little already. And so she comes in, we take out her teeth, and top and the bottom teeth. She comes in, the procedure's over with. She snaps in. She's talking like she's never had any issues. She came to me probably about 6 months later. She was off of all her medications except for one. She had gained 30 pounds back, and all her readings had changed.
Because
from the
she's
doctor.
eating better.
Yes, it was amazing. That lady was an amazing patient, and like I said, it didn't matter what age you are. And that's her thing. She was like, she had been through all the perio for 30 years. She had been through periodontal treatment and surgery and kind of had given up. And now she's like a changed person. She says, I wish I hadn't waited. That's the advice she gets.
Okay.
She wished she hadn't waited that long.
That's good. Now with this woman, because we talked about this in the green room, that teeth make you more attractive.
Yes,
There's
for
no
sure.
doubt about it. She looks better.
That's the number one thing that people look for is a smile. It's the first thing someone looks at when they look at something.
You know, we talked about bad teeth. People with bad teeth are judged.
Right.
In the movies, what do?
Exactly. They take out a tooth.
If you want to make somebody look, dumb, you take out their front tooth, or if you want to make them look poor, you mess up their teeth.
Correct.
So good for you. Now you have more photos.
I don't like to talk about this case because I feel like a lot of people are in this position. The patient came in and he had been to the dentist, and this is one of those ones that takes care of his teeth, but has crowns, fillings, and they keep on breaking off and they keep on breaking off. Now he's lost some of his teeth, and now he has to do something about it. At this point, we can't save his teeth. They've been worked on as much as you could possibly do anything with those teeth. They've root canal, they're breaking off now. So what is his option? Dentures? That's not an option.
Not in your practice. Okay.
No way. So we basically brought him in, removed his teeth, gave him implants, gave him new teeth, and now he's set.
Let's take a look.
Let's look at his smile, his demeanor. I mean, it's totally different. I mean, his smile is brightened up. It's amazing. He'll even tell you to this day. I can give you his phone number right now, and he'll tell you, hey, this is a total change. And
how soon can they eat after it's all done?
They can eat immediately. What I like to tell people, yes, there's some restrictions. You got to heal up, but
take it a little bit easy.
Right, exactly. You don't want to go crazy, but after you heal up, I mean, you're ready to eat whatever you want.
So
Nuts,
this is a guy that would have had a denture. Now he's got a brand new teeth. These teeth don't come in and out.
Right, they do not move. They do not move, and that's what he wanted. He's like, I do not want to be able to take my teeth out.
Could they eat chewy things like a pizza, or could they eat popcorn,
Pizza,
whatever?
Popcorn, nuts, whatever they would like, gum, whatever you could possibly think of, they could eat it.
Did they tell you these stories?
Oh,
Do they ever get
for
afraid, like, because they've gone so long without eating, and they say, Doc, are you sure I can eat this?
Yes. I've had patients that was like, I'm not gonna eat on these because I'm scared. I was like, go ahead and eat. And they come back and like, yeah, I can eat. They're so excited. Some patients just jump into it, but a lot of patients are just hesitant because they haven't eaten in so long.
What do they like more, the fact that they can eat whatever they want, or the fact that it looks good? Or is it both?
It's both, but initially it's probably function, but it comes down to aesthetics and how it looks at the end of the day.
The compliments and things like that.
Yes, it's amazing.
And is it true they're starting to take selfies on Facebook now and irritate all their friends?
For sure. I had this one lady that came in and she night and day difference how she looked. I mean, she came in and she was wearing a sweater and her hair was like all down. She came in the next time, her hair was dyed, and I mean, it was crazy to look at like the confidence she came in with. And you know what? She was actually wearing a partial, and her son, who was a nurse, came in to help her with the procedure after drive her home after IV sedation. And he was like, my mom's gonna be so happy that you can't see the metal in her mouth from the partial, because when she smiles, you can see it. And that was a big worry of hers, which is a big worry for a lot of people. And nobody wants to see metal in the mouth.
Yeah.
And so that was her big thing. And now she could eat, stuff wasn't getting underneath her partial and things. She was confident, and it was amazing. Her night and day, that was probably my biggest night and day difference, how she came into the practice the first day and she came in after everything was done. Cause I mean, her hairdo was like, oof. Are
awesome. You ever surprised, like you're thinking, I didn't even know this person was this, cool or this funny or this big of a personality?
Exactly. I mean, it happens every day. I mean, people come in.
It's just teeth, as I say, but you say it's bigger than that.
It's way bigger than that. I mean, it's way bigger than that. Everybody will, I always say a smile will change a person's day. A baby smiles, changes your day.
That's a good point, yeah.
I mean, who's gonna frown at somebody that smiles?
Yeah.
Even if you're in a bad mood and somebody smiles at you, it changes your whole.
Kind of pick up your face.
Exactly. It makes you just stop thinking about what you were thinking about was so bad in life. I mean, just smile at somebody.
Now we have to mention, because we're short on time, but Medicare, Medicaid does not cover this at all. Even with great dental insurance, only covers a very small portion. So what's the answer?
Correct. People are financing this every day at our office. I mean, it's an investment. No, you can't have bad credit.
So you have to have decent credit, but you can finance this.
Right, exactly. You can finance it, and like I said, it's an investment in yourself. People invest in all this stuff every day as far as cars and houses, but this is your health. And this is what you're gonna take to the grave. You're not gonna take a lot of that stuff to the grave. And financing options, they range. We have several that would third-party.
So low payments.
Correct.
Get a brand new teeth.
Right, exactly. People make payments for everything. People make house payments, people make car payments. Why not make payments for your health?
But isn't it true, if you've been wearing a denture like 20 years, 15 years, you don't have enough bone to do this?
You're right. No, you're not right. Okay. I hear this all the time.
You do?
Yes. Patients come in, it's like, oh, my dentist told me I don't have enough bone. They have enough bone. I mean, it's amazing that we're able to do what we're able to do with implants.
Good. You have more photos.
Yes.
I'm going to rush you through these because we have a few minutes left.
Yes, this gentleman, love the guy.
He looks pretty serious.
Yeah, he does look serious, but he's the biggest joker you'll ever meet. He's hilarious. But he's one of those people that was told they don't have enough bone. He went actually to another implant place, and they told him, hey, you don't have enough bone. And I can't remember.
So he didn't want a denture. I mean, that was his main
right,
thing.
exactly. And they were like, you're going to get a denture.
Then
you don't have enough bone. He found us, and basically we were able to give him what he wanted.
So when he tells you that, he says, hey, but doctor, I've been told I don't have enough bone. What do you say to that?
I say, let me see. Let us take our imaging, our 3D imaging. Let us do a comprehensive exam and see if that's true, because that's rare.
So what did you do for him?
This is what we did for him, Randy. You said the guy was a serious guy. Does that look serious?
No, he looks good.
He looks great. He looks really good. He's lit up. He looks even younger.
He looks like clip art that they use in these ads for older, healthier people.
Exactly. You can even.
He's looking good.
He looks good. His teeth look natural. You can even see that it has points and anatomy, and they're not flat across and looking like chiclets. And that's what we were able to do, give someone a natural smile.
Is that right? So he could eat whatever he wants.
He could eat whatever he wants. Here's another guy.
Wow.
And you can kind of see from that picture that's
got to be unusual.
That isn't unusual. You have these people walking around, and you might think they're depressed. They're just hiding their smile. They might look angry. They're just hiding their smile because they are embarrassed, or they don't have the confidence to smile, which makes sense. I mean, it's an aesthetic component to it. Basically, what was his options? He had a bacterial infection that it was too severe at this point. Options, dentures. Not an option in our office. that wasn't an option for him as a patient. He didn't want it. Let me tell you what we did for him. We basically gave him a upper and lower teeth that we took out the top and then took out the bottom and gave him
Very nice.
full complement of smile. I mean, you can see his whole demeanor has changed. I mean, the aesthetics look great. He's still a little guarded, but it's early.
Meaning he's not smiling big
Right,
in the after.
exactly.
Because he's what? Not used to smiling.
Right, exactly. This is pretty soon after he's gotten his new teeth. So, but now he's smiling great. And,
What makes him look healthier, right?
Oh,
When you have a nice smile.
for sure. I mean, it makes him look younger. It makes him look healthier. Young is healthy.
So we are out of time. Final message. If a patient is watching this, they're currently wearing a denture.
Right.
Or can't save their teeth, full mouth of extractions, and they go to your office. What are their options when it comes to dental implants?
Well, you got several options. One of the options is 2 implants to secure a denture.
Like a snap in,
It snaps in and
out.
snaps
Okay.
out. You even have 4 implants that can snap in and snap out. The more implants you have, the more security you get. You have 4 implants, you can actually make it where you can't take it in and out. It's non-removable. And
That
that's
seems like what everybody wants, right?
That's what everybody wants, hands down. Like, I could go through all the options, and everybody's like, I want that one. I want the non-removable one. And that's just all around the board.
It's like a
compliment.
third set of teeth.
Right, exactly.
In a way.
Exactly. Kind of like a shark, I
Okay.
guess.
So the upper, but aren't uppers good because they're suction for denture wearers?
I guess you do have a little bit more security than the bottom, but you lose so much sensory ability as far as taste and smell and all that stuff. I mean, a lot of people that do get the fixed option, it doesn't have a palate. They have to be careful when they drink their coffee now, because before they were drinking their coffee and it was like hitting the denture and just going straight back. So no, it changes people's lives and it makes it more natural for them that they are able to not have a palate in the roof of their mouth. And
Yeah, but
not
can't
have
your gums be too bad? What about the people with really bad gums?
No, it's not.
I mean, they could get implants?
Yeah, they could get implants. Once you take out the source of infection, which are the teeth, it changes the environment of your mouth, so you're able to get implants.
So the gums get healthy.
Correct. The gums get healthy. Yes, you still have to take care of the implants and do your 6-month recall or whatever, but it does change the mouth.
Okay, good. We're out of time. Final message. Somebody watching this, they're either in a denture or really bad teeth that are bad. But for whatever reason, they're still afraid. Maybe they've heard what you have to say.
Right.
They're skeptical. What do you say to them?
Come in, let us educate you, let me give you options, or let us give you options. And it doesn't have to be with me, it could be with someone else. But go learn about your options, get educated on it.
Okay, good. I want to thank you for coming on to the show.
Thank you.
Good info. And they go to your website, learn more, make an appointment. Did they get to see you?
Yes, for sure. They definitely get to see me.
All right, thanks again.
Thank you.
You've been watching the Wellness Hour, news that makes you healthier. I'm Randy Alvarez. For now, I wish you good health.
Thanks for watching the Wellness Hour, the leader in medical news with your host, Randy Alvarez, the authority on health issues.